Yeah,
some of the question
let me record. Yeah. Okay, so let me share my screen.
So earlier we've managed to write down the questions, some of the investigation questions, right?
Yeah.
Okay, so
we were able to
where
come up
were
with
we?
2 questions. First question is if he does have any sensory function in his legs, and that question was asked by you. This other brother asked if he does have any sexual function working, if his sexual function is working. So those are the 2 questions that we have already. So let me share my screen.
Yeah, I think that will help.
Oh, can you see it?
Yes.
Okay. So the case now we're discussing now is that of Gary. This is the case study D. A 19-year-old male was brought to the clinic by his father. So that tells you that Gary was in a car accident and he has lost his ability to use his legs and his trunk. So we discussed earlier that the trunks are the main body part of the body that contains the chest, the abdomen, the pelvic, and the back.
Okay.
Yeah. So what questions do we ask apart from those 2 questions outlined?
Maybe we should try to diagnose. I don't know, Brother Sam, if you have any other questions.
Yeah, Brother Sam.
So in the car accident, because now he can't feel his legs. So does he have any back pain? So he can't feel from the waist bottom, or it's just the legs?
Okay, so the first one was we're told that he has lost the ability to use his legs, which is one. And then they said, and his trunk. So I tried to discover the definition of trunk, and I was told that trunk is that part of the body that involves that contains the chest, the abdomen, the pelvic, and the back. So what it means is that from his neck down to his waist, from neck down to the waist is what is called the trunk, because that's where you can find the chest, the abdomen, the pelvic, and the back.
Okay.
So
yeah, I think we may just need to go to the diagnosis. There's not much to ask. Sorry, Sister Amara.
I think I have something like from what you said, that okay, like what you have said, does he
you are breaking.
Back pain? I think maybe we can ask something.
Well, so a question is because he if he can't feel that means can he feel pain though? Because if he can feel his legs,
my network is a bit wide. Can you hear me?
Can you come again? Finding difficulty hearing you. Brother Sam?
Yeah, no, I was saying, like, as she's talking about pain, can he feel pain though? If he can't feel anything.
Okay, so we should ask if he can feel pain.
Yeah, can he?
Yeah,
because we're saying he can't even feel a thing. So if he can't feel feelings, is he able to feel pain?
okay. So that should be one of the questions we should consider, right? If he
Maybe
can.
we should leave that question.
What do you say?
Maybe we should eat.
Hello.
Hello.
It seems like your network.
Yeah, my network is very bad.
Okay. Any more questions before we move to the next, Brother Sam? Yes, Brother Sam.
No, you said something. I just didn't hear what you said.
Okay, I said any more questions before we move to the next? Are we there?
Yes.
Yeah, I said any more questions to ask before we move to the next?
I think let's move on.
Okay. So we've considered the possible question to ask. Can he feel pain? Does he have sensory function in his legs? His sexual function is working and all. Then after finding out these questions, what do we think? What do we think is the possible case? What are we looking at here? What could Gary be suffering from? Hello.
Yeah. Let us see. Yeah, there's this what they call
Is Brother Sam here?
paraglid. Brother Sam, yeah, he's still
I'm
there,
here.
I'm sure.
Yeah. So any idea what Gary could be suffering from?
Yeah, Gary should be suffering from paraplegia. Paraplegia. Yeah, something like that. Paraplegia.
But Sam, do you think that's what he's suffering from?
I'm just still checking, Matthew.
Okay. Okay, so let's check some of the signs and symptoms of paraplegia to know if that is what he's suffering from. Right? Hmm? Sister
I
Ramba,
think it's paraplegia.
paraplegia, right? Hello?
Yes.
Okay. So let's consider the signs and symptoms to know if that is what Gary is truly suffering from.
Okay.
So what are the signs and symptoms of paraplegia?
Paralysis is the first one. So he's got paralysis.
He's
So his
lost.
spinal cord has been damaged. So it's like paralysis.
Okay. So his spinal cord has been damaged. What else? Huh?
Okay, let me see.
Do you also notice that one of the symptoms said loss of motor and sensory functions in legs and trunk? And from what we read, they
Yes.
told us that yes, that he had issues too. That
Yeah.
from what we read, we told about his trunk. That
Yeah.
according to what we read specifically, we're told that
Yes, correct.
yeah,
Yes, that he's strong.
to use his
Yes,
legs.
correct.
Yeah. Any other signs and symptoms?
Into this
That could solidify that this is what he's facing truly.
yeah. I think that's it.
Okay. So what let's talk about the etiology of paraplegia. What are the etiology?
Okay. Okay, a consequence of fracture, dislocation, or both of the vertebral column. That's the etiology of this disease.
Okay, so consequences of fracture, dislocation, is that what you said?
Yes.
Or what?
Or both of the vertebral column.
Okay. So how do we diagnose? How do we diagnose? What are the diagnostic procedures before we talk about?
Because the vertebral column is basically like that whole section of the vertebrae, right? So that there's I think it's like a little bit of thin muscle that protects the spinal cord and that fluid that's in the spinal cord. So I think because it's been damaged, that's the reason why there's like no function, because the spinal cord has been exposed and that fluid is no longer moving there.
Okay. Wow. So before we begin to administer treatment to Gary, what are the diagnostic procedures?
There is need for a thorough neurological assessment.
So basically, I think that neurological assessment is to test your nerves. Do you know how sometimes doctors like prick you with the thing and they're like, "Can you feel that? Can you feel that?" And they
Yes.
usually like prick where your nerves are, or pinch you, because I mean, if we are pinched, the pain, they are caused, like pain is caused by the nerves because our nerves are reacting, right? Like heat, when you burn, is because your nerves are reacting. So I think definitely they'll be testing all your nerves as part of that neurological assessment.
When is this diagnostic procedures done? After the accident, immediately after the accident, or when?
Yeah, definitely after the accident, because if someone comes to the hospital after an accident, obviously they will check for if there's any internal bleeding. I think that's one of the first things they do. And if they see everything is fine, I think they check for head injuries, concussion, and that's part of it. I think that's also when they do this, like they ask them where do you feel the pain? And I'm sure if the person cannot feel their legs, they can be like, okay, I can't feel my legs. And then obviously immediately after, then they start checking for their nerves to say, if I do this, can you feel this? Try and move your finger, try and move your toe, that type of thing. So straight, I think they do it after the patient has been brought in and they've tested. I think after they look for internal bleeding or head injuries. I think head injuries are the most scariest ones. So I think they start with those and they just assess as they go.
Do we have anything to add to the diagnostic procedure?
There's spinal X-ray, spinal CT scanning, and MRI are some of the procedures, diagnostic procedures that should be done.
Why is the MRI needed?
I don't know. Maybe to check
Yeah, because I've always thought an MRI is for your brain, right? Is it maybe for brain activity? Because I've always thought, unless I'm wrong, but I've always thought an MRI is for your brain.
Well, MRI
yeah, maybe the sensing.
MRI too can also be used to determine age. If you notice in soccer or football, when players present their age and say maybe on the youth tournaments, under 17, under 20, they use the MRI scan to check the bones because it's a magnetic resonance imaging. So it involves
yeah.
So maybe they are using that to, I don't know, maybe they're using that to determine how old the person is, to know how to begin what kind of treatment, because I don't believe treatment they give for a child or someone who is 10 or 12 will be the same thing for someone who is 30 or 50.
But remember also, Matthew, I think it may not only to determine the age of the person, because I think most patients, when you come in, they will obviously open a file. They don't want to know what your age is. But remember, even the MRI for the head, the reason why they give you one, say, for example, you have problems with your head, right? So they are trying to look for what's causing, say maybe you say you have intensive migraines. So they look at your brain activity and try and find if there's a tumor or something is actually causing. So most likely it's the same procedure, trying to look at what's causing the paralysis. Is it a nerve that's been maybe your nerves have been shattered? Is it a bone fracture that's stuck somewhere? I'm thinking maybe it's just could be the same, trying to look for the cause, like why are you not feeling your legs, or why are you not feeling your nervous system? I think it's still the same, that they're just looking at what's causing that.
So in other words, the MRI scan is more or less like for the whole body. So they just use that magnetic field and radio waves to get the picture of the interior of the person, right?
Yeah.
Yeah, so they will know where exactly. So I feel like
Yes.
the MRI is more like an all-rounder.
Yeah.
Okay, that makes a lot of sense. So after we've discovered the diagnostic procedures, how to find out what is wrong with this person. So what kind of treatment should be administered? So what kind of treatment do we administer to Gary?
Okay. There is need for immediate treatment since it is important to order in order to control the paralysis as much as possible. And the treatment for all spinal cord injuries includes restoration of spinal alignment, stabilization of the injured spinal area, decompression of the neurological structures, and early rehabilitation to minimize long-term paralysis.
Okay, so I have a question.
Okay.
Is there a permanent treatment to this? Is there a restoration of paralysis?
I almost also had the same question, like someone who's already been paralyzed, how do you fix that?
Maybe it now depends with the type of injury. For this boy, I don't think restoration of spinal alignment.
It's gonna fix
Restoration
anything
of
at this point.
I think there's need. I think there's need for that.
Okay.
But would the person walk? Because then you'd actually start thinking of people who get in certain accidents and they're told, hey, you're never gonna walk again, eh?
Yeah.
Is it not because of the nature of our services here in Africa? Don't you think so?
Not even even with the best surgeons, there are people who just are in terrible accidents and they're even told, hey, it's tight. You may
Are
never
not
walk
able
again.
to restore anything. Okay. But I think they should have tried to do it, then they failed. So we cannot just say we don't have to do that restoration of spinal alignment before even attempting to do it. Maybe after the MRI and the CT scan will show it's now beyond repair.
Maybe.
Because what I'm asking is towards the end of the treatment, if you have the textbook or the PDF file, it says early rehabilitation, right? Early rehabilitation to minimize long-term paralysis. So what rehabilitation do you need again to minimize what paralysis? The person is paralyzed. So what?
Okay.
So what rehabilitation do you need, and what are we trying to minimize?
Maybe physiotherapy. Could physiotherapy help you?
I think it depends on the extent, but this guy can't feel anything.
Yeah, and he's strong.
He's only working from,
And they talked about his strong. Apart from the fact that he cannot feel his legs, they talk about strong, meaning after the neck,
nothing else works. Yeah. So I don't even think physical therapy works for this guy.
So the only part of his body he can use is his head,
is his head,
the eye, the nose, and the mouth. From the neck down, you cannot use
I am not even serious.
No, for real.
That's a tough one.
Living a tough life, this guy.
Very tough one.
Yeah.
Tough out there.
Okay, so we have less than 8 minutes, and I think that's all. We have been able to discover that so probably all they just need is a therapist to just work with this person to make them understand that you can definitely still find your purpose on earth even if you're paralyzed and stuff. But I don't think there is any. Yes, because if you read the treatment that was outlined,
Brother Messi, you need to be serious.
If you read the treatment that was outlined, I don't think there's really hope, because it talks about immediate treatment is important. Okay, then it talks about treatment includes restoration of the spinal alignment. That's it. That is for somebody whose spinal alignment can be restored, not in Gary's case. And then it talks about stabilization of the injured spinal area, decompression of neurological structures, and early rehabilitation to minimize long-term paralysis. So many of these treatments could not be applicable to Gary.
Yeah, yeah. Yeah.
Poor Gary, eh?
So that,
Yeah.
yeah, so thank you, everyone. I think I just need to end the meeting. The first one was 40 minutes, this one is 40 minutes. That was well over 1 hour. It was really insightful.
Oh.
Say again. Hello.
I just say thank you.
Yeah, thank you all for your time. Thank you. If I have any question, I will ask in the group as regards how I'm going to send it to our instructor.
Okay,
Okay,
thank you. Have a blessed night.
Yeah, bye.
Bye.
7 minutes. I think I just need to stop this. How do I stop? Stop share and recording.